Most men ignore early changes in penis health. That mistake leads to serious problems later. Hi, I'm Dr. Ross. In this video, you learn early warning signs and the steps that protect sexual health. If sexual health matters to you, follow this channel for clear medical guidance. 2 points matter here. One common mistake many men repeat. One serious outcome linked with delay in action. Penis health reflects whole body health. Blood flow, hormones, nerve function, and mental state all show through erection quality and sexual performance. When erection strength starts dropping, internal systems often show early strain. Blood vessel health in the penis shares the same pattern as vessel health in the heart. Doctors often see a pattern. Men with early erection changes later present with circulation problems or heart strain. Pay attention here. First early sign appears as weaker erection strength during intimacy. Morning erections reduce in frequency. Sexual interest drops without clear reason. Second sign shows a slower response during sexual stimulation. Confidence drops during intimacy. Stress rises during performance moments. Some men notice reduced firmness during masturbation. Others report reduced sensitivity during stimulation. These changes develop slowly. Many men ignore them until progression becomes obvious. Now this part matters. Many men attempt self-made methods for penis enlargement or performance improvement without medical supervision. Some follow online advice involving forceful stretching routines on penile tissue. Others apply tight pressure methods aimed at size increase. These actions start from curiosity or frustration during sexual performance issues. Penis tissue contains delicate blood vessels and supportive structures. Repeated excessive pressure creates small internal injuries inside tissue layers. Over time, scar tissue forms inside erectile structures. Blood flow efficiency drops. Erection strength weakens. Sensitivity changes appear. Some men experience short-term perceived improvement, followed by long-term decline in function. Pause here. Repeated tissue injury patterns increase risk of erectile dysfunction in younger men. Some cases become long-term without early correction. Another risk appears when men use tight homemade rings or objects during sexual activity or erection control. These objects trap blood inside the penis. Swelling increases fast. Removal becomes difficult without emergency care. Severe cases lead to tissue damage from prolonged blood restriction. Recovery becomes complex when delay happens. Medical devices exist for specific conditions. Improvised tools increase risk of injury, swelling, and permanent damage. Small injury inside penile tissue rarely remains small. It often progresses into circulation problems or internal scarring. Many men delay medical attention due to embarrassment. That delay worsens outcomes over time. Early attention to erection changes, discomfort, or visible injury signs improves recovery outcomes. Penis health reflects overall body function. Early changes appear quietly. Ignoring these signals leads to progression of dysfunction. Next section explains full symptom patterns, hidden risks, common myths, and early correction steps most men miss. Mid-attention shift here. Many men misread early penis health changes and delay action until damage grows. Erection changes show up in simple daily patterns. Morning erection frequency drops. Sexual drive reduces without clear trigger. Penis firmness during arousal becomes inconsistent. Response time during stimulation slows down. These signs develop gradually, so many men assume normal variation. Another pattern appears during masturbation. Penis response falls weaker compared to earlier months. Sensation during stimulation reduces. Recovery time between erections becomes longer. Penile tissue depends on steady blood flow and healthy nerve signaling. Reduced circulation inside penile vessels affects oxygen delivery. Low oxygen supply inside erectile tissue leads to reduced firmness over time. Continued strain inside blood vessels reduces elasticity inside penile chambers. Many men ignore early erection variation because stress, sleep changes, and fatigue also affect sexual performance. Mixed signals create confusion. Delay follows. Pause here and focus. Pain during erection or sexual activity signals internal stress inside penile tissue. Discomfort along shaft or base region often links to strain inside supportive structures. Blood vessel pressure changes also contribute to discomfort during arousal. Another warning sign appears as visible changes on penile skin. Redness, small bumps, irritation, or unusual sensitivity often follow infection or poor hygiene habits. Foreskin areas without proper cleaning increase risk of inflammation. Inflammation inside foreskin leads to swelling and discomfort during movement or touch. Some men notice difficulty retracting foreskin over time. Tight foreskin movement signals narrowing of skin opening. Narrow opening increases hygiene difficulty and raises infection risk. Long-term narrowing leads to chronic inflammation inside foreskin region. Blood in urine or semen signals deeper internal issues. Urinary tract infection, kidney stones, bladder stones, or growth inside urinary tract sometimes appear through bleeding signs. Any bleeding episode needs medical evaluation without delay. Another serious pattern involves ulcers or sores on penile skin. Small sores sometimes appear painless at first. Slow healing sores raise concern for serious infection or abnormal tissue growth. Ignoring sores leads to progression into deeper tissue damage. Now, shift attention here. Many men follow myths around penis enlargement and sexual performance improvement. Online claims promote fast results through stretching, oils, or herbal mixtures. These methods lack medical evidence and create false expectations. One common myth involves stretching routines for penis enlargement. Repeated manual stretching places uneven pressure on erectile tissue. Microdamage develops inside supportive structures. Scar formation replaces flexible tissue over time. Scar formation reduces elasticity inside penile chambers. Reduced elasticity leads to weaker erection strength and reduced durability during sexual activity. Another myth involves topical mixtures claiming enlargement or instant improvement. Skin on penis absorbs irritants easily. Chemical irritation leads to inflammation, redness, and sensitivity changes. Repeated irritation damages skin barrier and increases infection risk. Some men rely on extreme sexual performance habits to fix erection concerns. Aggressive masturbation patterns create high stimulation dependency. Penis response adapts to extreme pressure and high intensity only. Normal partner stimulation feels less effective over time. Sexual response mismatch develops between solo stimulation and partnered intimacy. Focus here. Penile health depends on balance between stimulation, recovery, and circulation. Excess pressure or repeated trauma disrupts balance inside erectile tissue. Reduced balance leads to long-term performance decline. Another hidden issue appears from pornography overexposure combined with high-intensity stimulation habits. Brain reward system adjusts to repeated high-stimulation input. Normal intimacy sometimes feels less stimulating. Desire during real partner interaction drops in some men. Psychological arousal mismatch develops gradually. Midshift now. Many men ignore early hormonal changes. Low testosterone influences libido, energy level, mood stability, and erection strength. Early signs include reduced morning erection frequency, lower sexual interest, and reduced motivation during physical activity. Stress also plays a major role. Chronic mental stress increases cortisol levels. High cortisol disrupts testosterone balance and reduces blood flow efficiency inside penile vessels. Stress-related erection problems often fluctuate, but progress when unmanaged. Sleep quality directly affects penile health. Poor sleep reduces nighttime erection cycles. Night erections support oxygen delivery inside erectile tissue. Reduced oxygen delivery over time leads to tissue stiffness and weaker erections. Another factor involves alcohol intake. High alcohol intake reduces nerve sensitivity and lowers blood flow response during sexual arousal. Repeated exposure leads to persistent erection instability. Nicotine exposure damages blood vessel lining. Damaged vessel lining reduces smooth blood flow inside penile arteries. Reduced flow leads to weaker erection quality over time. Now focus on infection risk. Sexually transmitted infections present early through discharge, burning sensation during urination, genital itching, or skin lesions. Many infections remain mild at early stage, but progress without treatment. Untreated infections spread into urinary tract and reproductive structures. Fertility impact appears in advanced stages. Unprotected sexual activity increases exposure risk. Multiple partners without protection increases infection probability. Early testing reduces long-term complications. Another myth involves ignoring mild symptoms. Some men wait for severe pain before seeking help. Early penile symptoms often remain mild during early phase, but represent internal change progression. Delay allows progression from reversible stage into chronic stage. Now attention shift. Blood flow inside penis depends on healthy arteries and veins. Narrowing of arteries due to smoking or poor diet reduces oxygen delivery. Reduced oxygen supply leads to weaker erection response. Continued narrowing leads to long-term erectile dysfunction. High-fat diet increases cholesterol levels inside blood vessels. Cholesterol buildup reduces vessel flexibility. Reduced flexibility lowers erection firmness and duration. Physical inactivity reduces circulation efficiency. Weak circulation leads to slower erection response and reduced firmness during sexual activity. Now, important correction point. Many men believe erection issues only relate to aging. Younger men also experience erection problems due to stress, lifestyle habits, hormonal imbalance, and stimulation patterns. Age alone does not explain erection quality changes. Psychological factors play a strong role. Anxiety during sexual activity creates performance pressure. Performance pressure increases nervous system stress response. Stress response reduces blood flow into penile tissue. Reduced blood flow leads to erection instability during intimacy. Fear of failure creates cycle. One failed sexual experience increases anxiety during next encounter. Anxiety reduces performance again. Cycle continues unless addressed early. Another pattern involves relationship stress. Communication gaps between partners reduce intimacy frequency. Reduced intimacy reduces natural erection cycles. Reduced cycles affect tissue oxygenation inside penis over time. Now shift toward early correction direction. Doctors first evaluate medical history, lifestyle habits, and symptom pattern timing. Blood tests assess hormone levels, glucose levels, and cholesterol levels. Urine tests evaluate infection presence. Physical examination assesses penile structure and skin condition. Treatment options depend on cause. Hormonal imbalance receives hormone correction. Infection receives antibiotic therapy. Circulation issues receive lifestyle correction and medication support when needed. Psychological stress receives counseling support and behavioral strategies. Lifestyle correction includes improved diet, regular physical activity, reduced alcohol intake, and smoking cessation. Sleep improvement restores natural erection cycles. Stress reduction improves hormonal balance and blood flow regulation. Another key correction involves masturbation habit adjustment. Moderate stimulation patterns support healthy response. Extreme stimulation patterns require reduction to restore natural sensitivity balance. Safe sexual practices reduce infection risk and prevent injury. Protection during intercourse reduces exposure to infections and long-term complications. Warning signs for immediate medical attention include persistent penile pain, visible sores, blood in urine or semen, sudden erection loss, or severe swelling after sexual activity or injury. Many men delay action until severe symptoms appear. Early response improves recovery outcomes, and reduces long-term damage risk. Most men wait too long before taking action. That mistake leads to long-term sexual health decline. Now focus on what you do next. Doctors first check overall health pattern. Blood flow status, hormone levels, sugar control, and infection signs all get reviewed. These tests help identify root cause instead of guessing based on symptoms alone. Blood tests assess testosterone level, cholesterol balance, and blood sugar level. Low testosterone links with reduced libido and weak erection response. High cholesterol and high sugar reduce blood flow inside penile vessels. Urine tests check infection, inflammation, and hidden urinary tract issues. Infection inside urinary tract often affects sexual function and comfort during urination or ejaculation. Physical examination checks penile structure, skin condition, foreskin movement, and signs of injury or scarring. This helps detect visible damage or infection early. Treatment depends on cause. Hormonal imbalance receives medical hormone correction under supervision. Infection receives targeted antibiotic treatment. Blood flow issues receive lifestyle correction combined with medication support when needed. Psychological stress receives behavioral therapy and structured counseling support. In many cases, simple lifestyle correction improves function significantly when done early. Now pay attention here. In my clinic, I see this often. Men delay for months or years, hoping symptoms disappear on their own. By the time they come in, recovery takes longer because tissue changes have already started. Daily habits play a major role in recovery and prevention. Healthy eating supports blood vessel function. Diets high in processed food damage circulation over time. Balanced meals support hormone stability and energy levels. Regular physical activity improves blood flow. Walking, jogging, and resistance training improve vascular function and support testosterone levels. Poor activity levels reduce circulation efficiency inside penile tissue. Sleep quality restores natural erection cycles. Nighttime erections support oxygen supply inside penile tissue. Poor sleep reduces these cycles and weakens tissue health over time. Smoking damages blood vessel lining. Damaged vessels reduce blood flow response during arousal, leading to weak erection strength and poor durability. Alcohol excess reduces nerve response and hormone balance, leading to inconsistent sexual performance and reduced sensitivity. Now, clear guidance. Do this. Maintain regular exercise, improve sleep routine, reduce smoking and alcohol intake, manage stress levels, maintain safe sexual practices, address early symptoms quickly. Do not do this. Ignore early erection changes. Use unsafe home methods for enlargement. Apply unapproved substances on genital skin. Delay medical consultation when symptoms persist. Use unregulated devices on penis tissue. Prevention matters more than treatment delay. Penis health depends on consistent blood flow, healthy nerves, balanced hormones, and safe habits. When these systems remain stable, sexual function remains stable. Warning signs requiring medical attention include persistent weak erections lasting weeks, pain during erection or urination, visible sores or ulcers on the penis, blood and urine or semen, sudden loss of erection ability, swelling or injury after sexual activity. Now, final point. Most men wait too long. That is the mistake. Early action protects sexual function and reduces long-term damage risk. Watch for these signs. Act early. This video is for educational purposes only and does not replace consultation with a qualified doctor. If you want simple, clear medical guidance like this, subscribe and stay informed.